Hi, I'm Dr. Andrea Need, owner of Movement Physio and Wellness. This is a Pilates video for someone with low back pain. So we're going to work on mobilizing and moving the low back and strengthening abdominal muscles and oblique muscles on the side. Okay, so we're going to start on hands and knees. All right. So we're going to start in a cat position. So you're going to arch your back like a cat. And then you're going to take some really deep breaths into your rib cage. You're going to do diaphragm breaths into your ribs here. So I want you to take a breath in and try to expand your rib cage as wide as it goes and exhale. Good. Breathe in again. And exhale. You're trying to create a ton of space in your rib cage here. You're going to inhale with your diaphragm and exhale. If that feels challenging, you can just go to a regular flat back position here. So you're going to inhale, expand those ribs 360 degrees, and exhale. Good. Inhale again. And exhale. Good. So now we're going to go into a cat-cow. So we're going to inhale, look up, and let the belly relax. Exhale, cat. Good. Inhale, cow. Really let the tummy go. Look up. And exhale, cat. Good. We're trying to get the diaphragm moving here to create more space so that QL muscle, the muscle along your ribs to pelvis connection there, can loosen up. The muscles right here, it's usually one of those side back muscles that feels pretty tight. Good. One more inhale and exhale. Now we're going to wag your tail, okay? So we're going to wag right and left. So pretend like you're a dog and you have a tail coming out of your tailbone. And you're going to wiggle your hips. Keep that cat position. Feel a side body stretch here. Good. And then go into cow. Same thing, wag your tail. Wiggle your hips side to side. Good. Okay. So now we're going to go into a hug the baby and a bear plank, okay? So hug the baby, you're going to let your belly go and inhale, pretend like you're pregnant. Let the tummy go. And you're going to exhale, zipper pubic bone to rib cage, and feel your ab muscles contract back up into you. Good. Inhale, let it go. Exhale, zipper. Pubic bone to rib cage. Good. Inhale, let that go. And on the exhale, we're going to hover our knees and go into a bear plank here. And hover. Shoulders under wrists, hips under knees, and lower back down. Good. I have a modification here. If your toes are bothering you, you can use a rolled up towel and put that under your ankles here. So same thing, take a big inhale, let the tummy go, exhale, zipper abs, and hover. 5, 4, 3, 2, 1. Good. Inhale and exhale. 5, 4, 3, 2, 1. Inhale and exhale. Zip. 5, 4, 3, 2, 1. Good. Inhale and exhale. Zip. 5, 4, 3, 2, 1. Good. With all of those, you should not be feeling that in your back. You should mainly feel it in your abs. Okay. So now we're going to roll and switch onto our sit bones here. I'm going to get a ball, and I'm going to just keep this towel blanket here so my ball doesn't roll away. The ball's going to go at your low back, your sacrum right there. Just going to keep that there. Good. And we're going to start by sitting up nice and tall here, okay? Our feet are hip width apart, knees are bent, arms are out like a ballerina. So you're going to inhale, grow tall. Exhale, you're going to do a roll up, curl your low abs, make a C shape with your back till where you feel some good tension in your abs. Inhale and exhale. Slowly roll yourself back up to the seated position. Good. Inhale, exhale, curve your low back, pull your belly button into your spine there till you feel your abs kick on and engage here. Good. Inhale and exhale. Come back up tall. Inhale, exhale. We're tucking that pelvis, we're curling back till I feel my abs kick on here. Now I'm gonna open up my right arm, twisting at my abs, coming back to center. And I'm gonna open up my other arm, sorry, the wall's here, back to center, and then come back up. Exhale, curve. Really feel that tension kick on there. My back is being supported by that ball right there. Good. Open up the right arm, twist in your abs. Exhale, open up the left arm. And then come back up. Exhale. Again, open, like you're reaching to the back corner of the room. Open the other side. Sorry, the wall is in the way for me. And then come back up. Good. Let's do one more. Curl and tuck your low pelvis here. Feel those abs kick on here. Open, twist, back to center. Open, twist, back to center. And then roll up. Good. So now we're gonna take away that. Oh, you can keep that ball though. And you're gonna sit up nice and tall here again. And we're gonna exhale and roll all the way down. So curve your low back. Roll down one vertebrae at a time. Nice and slow. Use those abs. Control, control. And down. Good. All right. Let me reposition myself. Okay, so now we're gonna do one leg in tabletop. You're gonna take that ball and place it on your right knee in tabletop here. My left arm is on the ball, which is on my right leg, okay? You're gonna take a breath in and exhale. All I want you to think about is zippering your abs and just pushing gently into the ball. So your knee pushes into the ball and your hand pushes into the ball. Good. Inhale, let that go. Exhale, just think about pushing like 50%. We're just trying to kick on these abs a little bit better in this position. Good. And then inhale, let that go. And exhale. You don't want to feel this in your low back. You really want to feel it deep here. You can keep your hands in your lower abdominal pelvic area. Good. And then exhale. Good. So now we're going to do a little curl up with this, okay? So what you're going to do is you're going to curl and lift your left shoulder off the ground. So inhale and exhale, and then inhale to return. And exhale. So I'm just trying to lift my left shoulder up. My neck is nice and long. Good. If that bugs your neck, just get rid of the ball and use your hand to support your head. Good. But we're trying to do an oblique crunch across your body to the opposite side. Good. Inhale, exhale. Good, one more. And exhale. Good. Lower that leg down. Ball in the right hand, left knee up. Ball to the knee. You're going to press, inhale, exhale, press, knee into the ball, hand into the ball here. Feel those abs zippering and kicking on here. Good. Inhale, exhale. Good. Inhale, exhale, zipper. Inhale, exhale, zipper. Good. Now let's do the oblique crunch. You can do it with a ball here, pressing into that, or you can support your head. So you're exhaling, thinking twisting across your body here. Exhale, inhale. Exhale, inhale. Exhale, inhale. Exhale, inhale. Good. So to progress that, we're going to bring both legs up into tabletop here, and we're going to do some crisscross crunches. So we're going to extend left leg, bend left knee, or excuse me, right knee's bent. And then we're crossing over to the left side, back to center. Extend left leg, twist to the right, back to center. Extend right leg. Good. Really slow and controlled is the name of the game. Good. I'm going to lower my head down, lower my feet down, and I'm just going to rock my knees side to side. With that, you should not feel the tension in your low back. If you are, we need to not be in double leg tabletop. We need to put one leg down and just extend one leg like so. Okay, good. Do a couple more twists here. Good. Okay, so now we're gonna go back up into right leg and tabletop. What we're gonna do is keep your right knee in line with your right foot. The leg is going out to the side, away from the body, and then it's coming back towards the body here. Good. So our abs have to kick on to create stability in our pelvis, okay? Because we don't want the pelvis to tilt and rock like this. We want to keep the pelvis really still. So here are my pelvic bones here. I'm exhaling as just my leg bone goes away from my body, then my leg bone goes towards my body here. Good. This is how it looks from this position here. So this leg is here, it's moving away, and then back to center, okay? Good. So keep going with that. Exhale, inhale. Good. Exhale, inhale. Good. Exhale and inhale. Again, my abdominal area, this is stationary. Everything is staying still here. Good. And let's switch sides. Left leg up. Exhale, moves away from my body. Inhale towards my body. Exhale and inhale. Good. Yeah, you can keep your hands on your ribs and your pelvis to make sure this is staying still. It's just the leg bone moving in the socket, okay? Exhale. And it's surprisingly a little tricky because your body wants to come with it. So you have to really control your core and pelvic area here to not let it come with your leg, okay? Good. Let's do one more. Good. And lower that back down. Nice. You can do a little twist back and forth. Good. Okay. So now we're going to go on our sides. So I'll make sure you can see kind of my legs in this angle. So I'm going to keep my head rested on this little towel or blanket. Good. So what I'm doing here is I'm zipping my abs, of course. My body is straight side, so my ribs are stacked, my hips are stacked, okay? I'm going to exhale and lift my leg. I'm going to keep my leg in this position about hip width apart, and I'm going to slowly bring my leg in front of me forward, straight towards the camera, and then I'm bringing my leg back away from the camera. Good. So it's staying hovering. Again, this is a tricky one where your body wants to come with the leg like this. You're working to control the trunk and not let it move, okay? So see if you can exhale and inhale. Good. exhale. And keep your hand on your pelvis here to make sure you don't twist and move a lot. Good. Inhale and exhale. Inhale. Good. Keep those abs zipped. Really feel lower abs zipping here. Exhale and inhale. Again, the farther the leg moves forward, the harder it's going to be. So you might want to put your hand here, but see if you can do it without your hand touching the ground. If you need support, just like light fingertips touching the ground here. Okay, good. One more. Good. And bring that leg down. Now you're going to bend your knees. Get rid of this. And we're going to go up onto your elbow. So we're going to go into some side planks here. I want you to be really tall in your chest. Don't sink into your shoulder here. Push your body away from your shoulder and arm. Good. Knees are bent 90 degrees. Feet are in line with your hips here. Your elbows right underneath your shoulder. You're going to exhale and go up into a side plank here. So my hips come forward a little bit to create this line. And then inhale back down. Good. Exhale. And I'm really staying really stacked. I don't want to be twisted too far forward or too far back. I'm really stacked straight there. Good. And inhale, exhale. And back down. Again, you really want to feel it here. Your side bodies here and here. And back down. And exhale. Down and exhale. Down. Good. All right, let's go to the other side. We're going to do those leg kicks first. Grab a little towel or pillow to rest your head on. Good. My hips are stacked here. Zippering my abs. Exhale as you lift your leg. Good. Hold it there. Inhale to prepare. Exhale, my foot comes towards the camera. So I keep my body stacked. Good. Inhale back. Good. Exhale forward. This is secretly a really tricky one because your body wants to twist with the leg. So you have to keep your abs and obliques really kicked on here as the leg is just moving forward and back. I need to relax my shoulder. Again, you can do fingertips here if you need the balance. But see if you can do it without. Good. And you'll feel this in your glute and your hip too. It's good. Good. One more. Good. And lower that down. You're going to bend your knees, come up onto your elbow. Elbow stays underneath shoulder here. Knees are bent, feet are in line with hips. You're going to inhale to prepare. Exhale, hips come forward. Inhale down. Again, hips are stacked, spine is stacked. I'm not twisted forward or back. Inhale to lower. Exhale, lift. Hips go back down. Exhale, hips come forward. I'm basically one long line from my head to my knees when I'm up here like this. And then my hips are back and then bent again, okay? Exhale forward. It's kind of hard to see on the camera. Inhale back and exhale. Good, and none of this should cause back pain, so if it does, we just need to maybe not go up as far, just a little small lift there, okay? Let's finish up with a child's pose stretch with lots of diaphragm breathing. And we're gonna stretch our arms to the right and left sides to get more of that QL muscle stretch, okay? So toes to touch, knees are wide. We're gonna reach arms straight forward. Good. We're gonna diaphragm breathe into our back rib cage. So I want your breath to go back here, okay? So you're gonna inhale, Let the tummy go and exhale. We shouldn't be gripping our abs here. It should stay really relaxed, okay? Inhale and exhale. Good. We're going to reach both arms to the right side to stretch the left side of our low back. So make sure your head's rested down. Inhale and exhale. Inhale and exhale. Good. Stretch the arms to the other side, left side to stretch the right side of the low back. Good. Inhale and exhale. And inhale and exhale. Good. All right. I hope you enjoyed this video, Pilates for low back pain. Let me know if you have any questions, and I hope you have a great day. Bye.